Catalina Sol, what do we know about the Latino community in the United States that leaves it more vulnerable, that leaves it disproportionately affected by HIV infection?
Well, I'll speak to the experience that we have locally here in Washington, D.C. The community that we serve at my clinic is primarily an immigrant community and not born in the United States. And one of the major reasons why we're vulnerable to HIV is lack of access to health care. So the large numbers of Latinos who are represented among the working poor who aren't eligible for Medicaid or the safety net programs and also don't have benefits through their work already leaves people in the margins of the healthcare system and really with little access to information about HIV, testing for HIV, and care. That's one of many reasons. There's many also cultural reasons. The stigma of HIV is very high in our community, and it leads to fear of testing or fear of seeking care even when those services are available. And also a lack of practice and comfort with talking about the things that place you at risk for HIV, such as sexuality or drug use.
Oscar Lopez, is it that stigma that keeps people undiagnosed and makes them dangerous for passing it on to others?
I think that has a large part to do with it, because here we are 27 years into this epidemic, and not only within the Latino community, I think nationwide for sure, there's still a lot of stigma associated with the disease. There's so much homophobia associated with the disease that, I mean, if you were to be diagnosed with cancer or something else, no one asks you how you got it. But when it's an AIDS diagnosis, an HIV diagnosis, people immediately wonder, well, what did he or she do to contract this? And the fear and anxiety about, possibly being labeled, whether it's a drug user, promiscuous, possibly gay, is enough to keep people from wanting to know or from ever disclosing to anybody else.